We are live, Mathur.
A very good evening to one and all. A warm welcome from the YOSI Medical Legal team. Today we have the screen is not moving. A warm welcome from the YOSI Medical Legal team. So we have gathered here for another exciting session of Medical Legal Aspect series. So far, we have covered nearly 22 topics. A few of them include consent, Consumer Protection Act, record keeping, indemnity insurance, how to respond to a legal notice, endophthalmitis, cataract surgery related medical legal aspects, ROP and medical legal aspect, issuing medical certificates, anti-VEGF, billing related medical legal aspects, medical legal issues related to mass surgeries, refractive surgeries, tackling assaults against doctors, medical legal aspects of the live surgeries, and then permission for eye hospital and legal licensing, daycare center and ophthalmology. And last session was on medical legal aspects of transplantation of human organs and tissue act. So today we have a session 23 in the series, and today's topic is medical legal aspects of insurance law. And speaker for the session is Dr. Manoj Mathur, sir. So first I'll be introducing the panelists. First up we have Dr. Anand Deshpande sir, who is the director and eye surgeon at Guru Prasad Rangnalaya at Aurangabad. Sir is the chairman of the Indian Medical Legal Consulting Services Private Limited and also the chairman of Medical Legal Committee of AIOS in the current session. Sir is the faculty of law and visiting professor to Symbiosis Law College Pune and National Law University Aurangabad. Also is the faculty of management Sciences, BAME, Aurangabad. Sir has written various books of legal aspects in ophthalmology, to name a few. Next up, we have Dr. Prakash Marathe, sir, who is the past president, who is the consultant ophthalmologist at the Netrayogi Eye Clinic, Pune. Sir is the past president of Maharashtra Ophthalmic Society, Pune Ophthalmological Society, and in IMA Pune. Sir is also the trustee of Pune Ophthalmic Society and IMA Pune, and he is a member of Medical Legal Committee of AIOS. Sir has been the past managing committee member of the AIOS, past senior vice president of the IMA Maharashtra State Chapter. Sir has received various awards, and to name a few, Sir has received award of appreciation award by National IMA headquarters at New Delhi in 2018 and again in 22. Again, appreciation award by IMA Maharashtra State for continuous for almost 5 years. Then President's Special Felicitation Award by IMA Maharashtra State for 2021 and Pune Ophthalmic Society late Dr. Asha Kelkar Award in the year 2022 by Pune Ophthalmic Society. We welcome you, sir.
Thank you,
Next
sir.
up, we have Dr. Vishal Agrawal, sir. Sir is the director at Agrawal Hospital, Jaipur. He is a prolific vitreoretina surgeon. Sir has done his post-graduation from prestigious Dr. RP Center, AIMS, New Delhi, and surgical retina fellowship from Shankar Nethralaya, Chennai. Sir is a faculty was a faculty and university certified dissertation guide in SMS Medical College, Jaipur, in the Department of Ophthalmology for more than a decade. So, main area of his interest are surgical retina, ROP, and macular interface disorders, and he has co-authored various books published in index journals and performed live surgeries in national and international forum. Sir is also the past secretary of Jaipur Ophthalmic Society and also on the editorial board of Indian Journal of Ophthalmology. He is the principal investigation for more than six FDA-approved multi-center trials on AMD, RVO, and uveitis. He is currently the chairman scientific committee of the Rajasthan Ophthalmic Society. Sir has received various awards. To name a few, American Society of Retina Specialist Honor Award in 2023, Seattle. Reed Buckler Best Video Award at the ASRS. Image of the Year ASRS in 2019. Best Video Award in Retina, Copenhagen. Then Best Video Award in Rajasthan Ophthalmic Society in 18 and 20. Best Surgical Video Retina Award in Delhi Retina Meet in 2022. And various image awards as well. We welcome you, sir. Thank you for being here for our session. Now I would like to introduce the speaker of the session, that is Dr. Manoj Mathur, sir. Sir is the senior consultant in glaucoma and comprehensive ophthalmology at Swarup Eye Center, Hyderabad. Currently, he is the honorary treasurer of the AIOS. He's also the past advisor and president of the Telangana Ophthalmological Society and Hyderabad's Ophthalmological Association. He's the co-chair of the Health Insurance and TPA Committee of AIOS. He has been a member of Medical Legal and Ethics Committee of AIOS in the past and has been twice member of Managing Committee of the AIOS. Sir has also received member of the served as a member of the advisory board of the IGM. His motto is "He alone lives who lives for others. Rest are more dead than alive." We welcome you, sir. Thank you for joining in. Now I will stop the screen sharing and I request Manoj Mathur sir if he's here. I can see his name, I think, but meanwhile, sir, Marathi sir, if you would like to comment on the current topic which we are going to discuss today, till the time Mathur sir joins in.
Good evening, everyone. I think Dr. Manoj Mathur is here. Let me congratulate YOSI team for wonderfully organizing this webinar series on medical legal topics. Medical legal aspects most of the times are not taught to us in our MBBS curriculum as well as post-graduation. But then when you are doing your practice, maybe you are very good in your scientific knowledge, tackling your patients with consultation and surgical aspects. Then you realize that this is also one of the important aspects in your practice. And then you realize, but then the time is already gone because there was no training when you are undergraduate or you are postgraduate. When some unfortunate case comes, that time it is the very unfortunate situation for that particular consultant, how to tackle it, whom to contact, how to contact, from whose initiative the case can be taken further like that. So for this particular reason, I think yes, YOSI has taken this initiative and we have done almost 22 webinars on these various topics, and which will be useful for and beneficial for all the members, those who are attended, and even these webinars are available on YouTube and other social media. So one by one, we have discussed so many topics, and today's topic is given to Dr. Manoj Mathur because he is the important person and who is tackling these issues about medical legal aspects on insurance and various things. So, Dr. Manoj Mathur, are you here?
Sir, Manoj sir has got some problem with his system, so he's re-logging. Maybe we'll wait for him to join back with us.
Okay. If he's joining, then it's okay. Otherwise, I can start with his presentation.
He has joined in just now.
Okay.
So, Dipanshu, would you like to invite Dr. Vishal Agarwal sir for his comments?
Good evening, sir. Sir, are you there? Vishal sir, are you there?
Okay, till Dr. Vishal speaks, I think I must congratulate the team headed by Dr. Kaushik Tripathi, Dr. Dipanshu, Dr. Aarti Heda, and not to forget the main office bearers of AIOS, YOSI, those who are allowing you to continue this webinar series. And this is the independent wing which is continuously working for YOSI. And to take it forward for more than 2 years, definitely is a great challenge. To start with, we had thought that how many topics we'll be able to cover. I think it is the series which is already almost all the things are covered. Then we realized that so many topics are still there which can be discussed. I think Dr. Manoj Mathur is here. I welcome Dr. Manoj Mathur.
Yeah, good evening. I'm logged in from my mobile phone. My laptop is still hanged. Aarti, can you share screen? Yeah. If I am speaking, are you able to?
Yes, sir. We can hear you.
So you're audible, sir.
Now, yeah, you can start the introduction. I think I will speak from the phone. My mobile phone.
Yeah, sir. Since we utilized the time when you were trying to log in and we are done with the introduction part of it. So maybe you can go ahead with your presentation, sir.
Sure. So let me start. Thank you for this technical, sorry for this technical glitch. Thank you, YOSI, for giving me this opportunity. I would like to extend my gratitude to all the panelists. Just go back. All the panelists, Dr. Anant Deshpande, Dr. Prakash Marathe, and Dr. Vishal Agarwal. And my love and affection and blessings to Aarti, Dipanshu, Kaushik, and Ridhi. So sincere thanks to the YOSI office bearers. You are doing a wonderful job by organizing these webinars on medical legal aspects. So the topic given to me for this session is insurance law. And for a budding ophthalmologist or an entrepreneur and for a secure career, for professional security, you need to have professional indemnity insurance and hospital indemnity insurance. And then you, if possible, have equipment damage cover, and then social media and legal protection. and to have your security for your personal life and for your family, you need to have personal health insurance, term life insurance, investment plans, and last but not the least, motor vehicle insurance. Next slide. So for professional security, let us first consider the professional indemnity insurance and the hospital indemnity insurance. So what is professional medical indemnity insurance? Professional medical indemnity is an insurance plan to financially safeguard medical practitioners against legal costs and claims for compensation by the patients in case of a legal row. In today's litigious world, claims can be significant and can be detrimental to the financial security of the doctor. The doctor's expertise is protecting the health of the patients, and medical insurance experts advises the doctors how to protect their professional interest. Why is professional indemnity required is doctors are professionals who face the risk of a financial liability, and doctors therefore require special insurance so that they can protect themselves. So why professional indemnity become a necessity for doctors is it is a staggering increase of 5.2 million medical negligence cases annually in India, a whopping surge in the legal battles emphasizing the urgency to have this secure plan. The 110% increase in malpractice incidents are seen, and therefore the rights of the doctors and the patients need to be protected. Before we move further, we must understand the concept of vicarious responsibility of a hospital. Vicarious liability means a party is held responsible not for its own negligence, but for the negligence of another. In the context of medical malpractice actions, hospitals can be held directly liable for their own negligence and can also be held vicariously liable for negligent actions of the employee. So the hospital is legally liable for any malpractice committed by the physician, nurse, or any healthcare provider who are employed by the hospital. The scope of professional indemnity insurance is to provide cover for the extent of financial damage to the loss caused to the victim against unintentional errors and omissions by the doctor, insured, qualified, and non-qualified employees and staff. It also covers the cost of defending oneself in the court of law, that is the cost of decree. The plan covers for a year period. However, the policy does not cover criminal actions. This policy will pay the sum assured that has been set aside as a limit. The expense over and above the sum has to be borne by the doctor. The sum insured is referred to as limit of indemnity. This limit is fixed per accident per policy period. Indemnity insurance policies should be taken for doctors and hospitals with staff separately and should be renewed every year to meet the claims of Consumer Protection Act. Professional indemnity policies can be taken by two types. You can directly take from the national general insurance companies or go through professional protection groups. If you go with the national insurance companies directly, it caters only to the consumer claims and indemnity, any act by the insured who shall be registered medical practitioner giving rise to any legal liability to third parties, and insured includes policy holding and his qualified assistants and employees named by in the proposal, and the policies are available for individuals, hospitals, as well as diagnostic centers separately. There is a note of caution. The short period policies are not permitted. All claims have to be legally established. However, the company can offer an out-of-court settlement which should be accepted by the claimant. The jurisdiction is all Indian courts. If you have a group of 200 members and above, you get a discount. There is a co-pay the riders available, and the calculation of the premium depends on, this is a fine line that we need to understand. Any one accident, that means AOA, limit. If your policy says 25%, 33%, or 50%, or 100% selected for any 1 year limit indemnity. That means if you say that your policy is 25%, that means if you take a cover for 1 crore per accident, you will be entitled to only 25 lakhs cover. The most important clause to be understood is the act has to be committed during the period of insurance commencing from the retroactive date and the continued thereafter without a break. That means here the take-home message for professional indemnity is there is no grace period, and the policy should be mandatorily renewed before the due date. That means if you have taken the policy 2 years back, but this year while renewing the premium, you have paid your premium 1 day or 2 days after the due date. That means the retroactive date changes to this date and not 2 years back. Suppose in future, if you get a case, claim arising out last year, because there is a disruption of 2 days period, the claim is not entitled for compensation. So the important hallmark take-home message of indemnity insurance is there is no grace period and you need to renew your policy before the due date. So if you want to go have a protection of a cover of a group of individuals from associations or from societies, what you need to do is AIOS tied up with an MOU with Cover You as an intermediary and promoted AIOS Suraksha Professional Indemnity for ophthalmologists. What is this Cover You company? It is the only IRDAI recognized company. It caters to over 75 organizations, and it has a medical legal lawyers of over 10,000 spread all over the country. It has the services of over 500 plus senior doctors to guide, and as of now, they are serving to more than 2 lakh doctors all over the country. Next slide. Next slide, please. Next slide.
Sir, I have been changing the slides. Are you able to see them? Manoj sir, can you hear me?
Yeah, I am able
Slides
to
are not
hear.
changing, Dr. Aarti.
Slides are not changing.
Yeah, now they are moving actually.
I'm not able to see the slide.
Let me just stop the screen share and share it back.
Yeah.
So how is this a slide you are waiting to talk for?
Slide back. You just go one slide back.
So I was here.
Yeah, yes. You just share this next slide.
Okay. Is this fine?
Yeah, so these are the medical association tie-ups that this company has. Next slide. So the doctor's indemnity benefits. These are all the benefits that the company offers. Next slide. We need to go into the details of all these policies. Next slide. So these are all the benefits that the policy with Cover You offers. There is like more than 2 lakh doctors are covered, more than 75 organizations, and basically, so all legal notices are covered through this channel. Access to a network of over 10,000 medical lawyers, as I have already said. The best lawyer is assigned within 2 days of the, within 2 hours of any claim arising out of the situation. There is no restriction on legal fees. The freedom to choose your own lawyer is there. Extensive panel of senior doctors are there to guide you. Out-of-court settlements are possible. Then there is a zero reappeal cost. If you need to go again for an appeal, that is also taken care of. Multi-year policy coverage is there. There is zero compensatory excess. That means 100%. What I told earlier in the slide is like, if you take an insurance of 1 crore, you are entitled to a compensation of up to 1 crore rupees. Cashless claim settlements are possible. Immediate benefit access after quoting. That means if you have a medical insurance policy now, If you quote it with the AIOS Suraksha, if your retroactive date doesn't change, you will be entitled to claims even in the past. Then the runoff cover provided post-retirement. Suppose if you retire this year or if you stop practice and you are covered for 2 more years to take care of the eventuality that in the last year, if you have, if there is any claim that is covered, criminal allegation, the company supports you with the legal procedures, but if compensation is awarded, they don't pay. In case of criminal allegation, if that criminal negligence is proved, then you have to pay the compensation. But they cover you for the legal costs. Any defamation is taken care of, breach of confidentiality, and the loss of documents are also covered. Next slide. These are again all the 18 advantages that this policy offers to all the AIOS members. Next slide. So when there are so many inclusions, there are certainly list of exclusions. So whenever you are taking a policy, you need to go through all the list of exclusions and then tailor-make the policy as per your requirement. And these are the things like administering euthanasia or abetting suicide, all the criminal acts. These are the things. Let us not go into the details. There is a list of exclusions also. Next slide. So once you take up your own professional indemnity insurance, now let us consider the medical establishment insurance also. You need to take an insurance cover for your hospital setup. Medical establishment insurance offers specialized indemnity coverage for hospitals, clinics, and healthcare facilities. It focuses on protecting these establishments against medical malpractice claims, similar to professional indemnity coverage, along with additional benefits tailored for hospital operations. This includes legal liability protection, safeguarding against medical negligence claims, and ensuring the security of the healthcare institutions. Who are covered in hospital policies? It's the qualified staff, that is the doctors and the nurses, and unqualified staff, their ward boys and technicians are covered. Additional benefits of hospital indemnity insurance is they cover against fire, earthquakes, lightning, terrorism, riots, and malicious damage, aircraft damage and missile testing, etc., storm, tempest, flood, and inundation. All these, under all these circumstances, your policy is covered and you get compensation. These are the rates for individual professional indemnity as also the hospital indemnity insurance. Next slide. So there is a seamless claim process. The moment you get intimation to cover email, call, website, or associate through the association, you can contact the people, connect with a lawyer within 2 hours, complete discussion about the case, lawyer representation is given, compensation is paid directly to the patient, and the closure of the case happens subsequently. Next slide. So they have got good ratings. Next slide. So at CoverU, every client is like a family. Your trust fuels our commitment and perform even better. Next slide. So one thing important is through AIOS Suraksha, what AIOS has done is we are offering complimentary 10 lakh professional indemnity insurance to the first 2,000 registering AIOS members registered for the first year. So this is an incentive. We have taken a decision just last week. After the managing committee, we shall be intimating all the members. The first 2,000 members target, whoever expresses interest immediately, AIOS will offer 10 lakh complimentary cover. Then, next slide. Then CoverU people will try to contact you and request you to upgrade, because 10 lakh insurance is a very small amount. And if you upgrade your insurance further, this 10 lakh insurance cover is converted into personal accident. But if you don't want to upgrade your insurance package, still you can continue, and it is complimentary for the first year. Next slide. So indemnity insurance is a policy, is a direct contract between you and CoverU, and AIOS is only a facilitator. It means that for this insurance, like the insurance policy is directly between the person and cover you as an intermediary through an ICICI Lombard insurance, and AIOS is only a facilitator. This we need to be very clear about it. Next. So after this professional indemnity cover as well as the hospital cover, we are also negotiating a third aspect, that is equipment damage cover. You will be investing heavy amount for purchase of equipment, but there you need to have some insurance for this. The presently what insurance you are getting through hospital cover is the natural calamities that we have discussed. But this is a very difficult proposition for the insurance companies. If possible, we shall be proceeding further on this count. Otherwise, this thing is not possible. Next. The next thing is social media and legal protection. Nowadays, in the realm of so many social media, Facebook, reviews, Google reviews and all, patients can proceed to create harm for you. So you need to have social media protection as well as legal protection. So for this, we under comprehensive AI Suraksha, we are trying to provide, next slide, a scheme called Cover Prime. What happens in this is, it is a cyber insurance. It covers the defense representation, the risk management coverage, 24/7 consultation with all legal matters, social media and patient defamation protection. They give you legal notice drafting, case filing against third parties, vendors, patients, property disputes, as well as accidents. They provide legal consistency and take care of the cases also. They cover you, they take the case in the court of law and give you protection, and you can be at peace. So this is also being negotiated by AIOS with this intermediary. Now, after professional indemnity, now let us consider personal family security. To carry on with your practice, you need to have a personal family security. That is, you need to be healthy. So you need to take care of your own health. So the company provides you a plan. Next slide. A health insurance for you. Health insurance here, how does Cover You health insurance stands out compared to the other health insurance policies? Here, even the ambulance charges are covered, room as per choice. Presently, if you take health insurance, what happens is a certain percentage, like 1.5% or 2% of the cover is reserved for room rent. Here, there is no capping for the room rent. Daycare and up to the sum insured is provided even for daycare facility. There is infinite restoration of the sum insured. That means once you exhaust the amount, again it is reinstated instantly. There is a pre and post hospitalization expense is also covered, and you get a pre-existing disease cover immediately in the second month, whereas in the normal insurance policies, when you take it individually, there is a 2-year lag period after which the pre-existing diseases are covered. And you can get cashless claim facility under your health insurance. Next. It is just not your health insurance. Why you should need a term life insurance is, like your family has taken care of you. Your family has taken all the pains to set you up. You are now as budding ophthalmologist. You are setting up your practice, and now something, God forbid, something happens, then your family will be in trouble. So as a youngster, immediately the first thing that is required for all of us is to secure our family also, apart from taking care of your own health. This can be done by taking a term life insurance cover. That means in God forbid any certain situation, your family is not in trouble. Next slide. And regarding the term insurance policies, the add benefits are, it's a free add-on benefits are provided. If you take this term insurance, you get up to a discount of 15% on the first year premium. The coverage against all kind of death are covered. Additional risk riders like critical illness, accident, disability. So I Just give me a second because I think now my laptop is logging in.
Sure, sir. We understand that to read from mobile is not easy.
While I'm not able to read properly.
I know.
Select it by heart, all the
I
details.
think my
Unmute yourself, unmute. You are muted. You are muted. Yeah.
this is about the term insurance. Next slide. So now you have taken care of your health. Now you have taken a term insurance to protect your family. What is the next thing that you must do? Is you must have an investment plan. Every small saving, as youngsters, budding ophthalmologists, now you're trying to set up your thing, try to save something. Like every time you get messages in the network, social media, and like 20 years back, a person saved just 2,500 rupees per month. That sum has turned out to be 1.04 crores today. That is the scope of compound interest that it is possible. Is apart from all these covers, what you need to also think of for your personal and family security is to invest some amount in the investment plans. Next slide. So you can invest. There are diverse plans in the market. Capital guaranteed with market return, linked return, guaranteed return along with long-term income option, life cover applicable from day one, option to choose paying term and policy term, liquidity of money. It is easily, you can liquidate it as per the requirement anytime. You get tax benefits under ATC and 10D, and then option to top up investment amount. So once you take care of your liabilities, your professional security, your family security, what is some amount, all the youngsters, you should try to save in mutual funds so that your money grows. And by compound interest, you really get to save substantial amount in the future. Next slide. So last but not the least, even your motor vehicle, when you're driving your own car, the moment there is some touch to your bumper, it strikes just to your heart. You are so depressed and this thing, if any damage occurs to your car. So your car is like, apart from what we say is for your personal safety, you need to have a rooftop to cover your head. You have to have 2 to 3 meals a day. And if you have 4 wheels to drive, you are better than 80% of the world's population. So you need to secure even a motor vehicle insurance, and with AIOS Suraksha, under AIOS Suraksha, the cover you people, next slide, will provide motor vehicle insurance with 25% superior market value. You get to pay just 75% of your car insurance value. Add-ons are available up to 10 years, or in the market, all motor vehicle insurance, they give cover for 5 years. But here, zero depreciation is given up to 10 years. Engine protection is included. Consumable item coverage is also there, and invoice return protection for 5 years. These are all the add-on benefits that you get to take a motor vehicle insurance. Next slide. So in synopsis, for a secure carrier, what is required is you need to secure yourself professionally. And to secure yourself professionally, what is required is a personal indemnity insurance that we have said. AIOS has already signed an MOU with this organization, Cover You, and they provide personal indemnity insurance. And believe me or not, I was paying 13,000 rupees for just 50 lakh cover initially. And now, by paying just 6,400, you are going to get a 1 crore cover. This is the power of all of us joining as a group. Hospital indemnity insurance, they have given a chart. The rates are very competitive. And because of the vicarious responsibility for the hospital, you need to take a hospital cover separately apart from your personal indemnity insurance. And equipment damage, it looks difficult, but let us see. The social media and legal protection nowadays, in the years of Google reviews and all, you may get good reviews, you may get bad reviews. If you get any harassment from the patients or from the public, they try to unnecessarily harass you over social media, you can take a legal cover for a sum as less as 6,999 per annum. And regarding your personal and family security, you must take a personal health insurance. You must take a term life insurance. Here, when I speak about term life insurance, there is an alternate option available for all members of the YOSI, because all of you are under 40, and there is a scheme called Family Benefit Scheme of All India Ophthalmological Society members. That is a viable option. If you may opt to take a membership of family benefit scheme. Otherwise, you can take a term life insurance with under AIOS Suraksha. You must take a look at various investment plans. Every small investment every month is going to result in a substantial saving over a period of a decade or 15 years. And last but not the least, you can consider also in the package, in a bundle package, motor vehicle insurance at a reduced cost. Next slide. So AIOS Suraksha, what we intend to do very soon, probably in the first week of October or by 10th of October, what we shall be doing is we will be creating a tab in the website titled AIOS Suraksha. The moment you click on that tab, you will get an option to fill up your membership number. The moment you fill up your membership number, all your details are percolated. You need to fill up additional information as desired by CoverU. Whatever insurances you need to take, you have to just click on that. Then there will be a message saying your convenient time to stock, because our members complain, because once we give your data to these intermediaries, they will start telephoning you morning, noon, and night. So to prevent that frequent calling, you can provide the time for them to contact you, and they will get in touch with you. And with all you can take all the policies under AIOS Suraksha through CoverU. Next slide, the final slide. Again, a disclaimer from All India Ophthalmological Societies that all insurance policies are a direct contract between you and CoverU, and AIOS is only a facilitator. AIOS doesn't have any legal implications. We are only offering you a facility as a group. Suppose if 2,000 AIOS members collectively take this thing, then you get freebies and major discounts instead of taking individual policies. Next slide. Thank you very much for your patient hearing. And again, I would like to apologize. I just had to read through the slides in my mobile. I couldn't explain you properly till the time I could log in on my laptop. So thank you very much for your patient hearing. Any doubts or anything, let us discuss over this.
Thank you very much, sir. That was an elaborated talk. Now, I would like to invite our panelists, Dr. Anand Deshpande, sir, Dr. Prakash Marathe, sir, and Dr. Vishal Agrawal, sir, to give their insights on the medical legal aspects of insurance law. Deshpande, sir.
Yes, actually speaking, this is the best type of insurance which up till now we had in the history. Because up till now, for everything, there was a separate insurance, separate installment, separate papers, everything, and what lot of many problems were there. But now, AIOS has brought everything in one head. And only with having the AIOS insurance, we are having all the insurances of our hospital, our family, our own, and this is the best insurance policy. But we have to see in future what happens with this, and we will hope that this will work very nicely with us and we will be benefited with us.
Manoj sir, good evening.
Yeah, Vishal.
Sir, I have a few doubts about this.
Yes.
First is that when you launch, one second, once you launch that AIS Suraksha, we have the option of a bundled up scheme in which all these are included, and we have an option of selected if we have already one prior insurance, right?
Yes, yes.
And the second is if we have an existing insurance, we can port it to AIS Suraksha plan.
Yes, yes.
And then there will be different plans according to our personal preference, the sum insured. We can choose that also.
Yes. So what is happening is here you are tabulating your data. Like as Dr. Deshpande said, now I want my personal indemnity. I fill up a form, I take an insurance. I want hospital cover. Again, I fill up a form. Here what is happening is you are filling up your data with one intermediary, that is CoverU. And then CoverU is giving you a direct policy from ICICI Lombard. Then or through HDFC or the investment plans and all through HDFC. So the policy that you get, suppose if you opt for all the five, I want professional indemnity, I want hospital cover, I want social security, cover prime or cover elite or cover protect plus. They are designing three policies. So whatever policy you want, you're taking that. Plus you're taking a term cover for yourself. You're taking a health insurance, your own policy, as well as you're taking investment plans. So what happens is all these policies will be different, and the policies will be divided between you and insurance companies, but cover you as an intermediary, as the power of group of say 2000 AIOS members together, you are eligible for reasonable amount of discounts. See, the companies, they feel that doctors generally they drive their cars safely compared to a youngster. You take the case of YOSI. Our YOSI children, like they are being doctors, they are more interested in their profession, they drive the car safe, unlike rash driving by the other youngsters. So the amount of claims that the companies saw is almost 25 to 30% compared to the general population. Among doctors, the claims are about 25 to 30% compared to the general population. So they take these data into consideration, and by that they offer you 25% discount straight away over your motor vehicle insurance. So as a group of AIOS members, if you take the motor insurance policy together, you get the benefit of that 25% extra discount compared to the normal rates. Similarly, for this other policies, you get good benefits, add-on benefits compared to the other policies in case you take them individually. So we
Sir,
have
and
launched
one thing
AIOS
more is that
Suraksha. Yeah.
it does not. I was saying I have an accident and emergency policy also, in which there is a coverage of loss of working hours if I have a
Yes,
fracture or a
yes,
certain
yes,
accidental
yes,
bedridden
yes,
state for a month or
yes,
so. But
yes.
that I could not find in your presentation. Is that also included in that
Yes, if you
Suraksha?
have yeah, suppose if you have an existing health insurance policy, like for example, me and my wife, like since I am a senior citizen and my wife is about to be a senior citizen. So what happens is we end up paying, this year I paid 68,000 rupees as an insurance premium for a 10 lakh cover with a bonus of 5 lakhs. So for a 15 lakh health insurance cover for as a floater plan for me and my wife, I end up paying around 70,000 rupees. And once my wife touches the 60-year group, my insurance premium touches 80,000. So that is substantial amount. So as a group, if I am going to get this in the further saving of 15 to 20,000 rupees, all of us put together, that is a substantial saving for all of us together. So that is the essence. Some similarly, the term insurance, like now what is happening is we have an FBS AIOS that gives you a it's a sort of a term cover of 25 lakhs, and you have to pay depending on the number of fatalities, you have to pay a fraternity contribution. So instead of that, if you take and that age restriction is there up to 49 years. So if you are a member of AIOS today, age 50 years and above, up to 65 years, you can't join family benefit scheme. So you have this option of taking a term life cover through AI, under AI umbrella of AI Suraksha.
One thing I will request Dr. Mathur,
Yes.
so more explain whether there is a thing that if indemnity insurance alone is taken this much amount premium for 1 crore, and if add on facilities, that is car insurance, health insurance, and other insurances are added on, whether there is a add on premiums on the original indemnity insurance.
That is a direct negotiation between cover you and you.
Okay.
So they
Okay.
have a standard rate, because you can't have a fixed rate for health insurance because there can
Yeah.
be pre-existing diseases. Your age is also a consideration.
Age
They
and
can't give us a
diseases.
common chart. So it
Yeah.
depends on various factors. Similarly, term life insurance. Term life insurance also, it is just not your age. If you say that I am 55-year-old, but see, if I have a pre-existing disease of diabetes, hypertension, or if I have a heart issue, then my term cover will be certainly much, much more than a normal healthy individual of 55 years. So that is the reason why they can't give you a tabular column cover for all these insurances. That is a direct negotiation between you and the cover you. What is important for us is we can concentrate on our practice. All our needs, personal and professional, are being this cover you people. They are going to be your insurance managers. That is
So
in one
this
sentence.
premium will be added to other indemnity insurance premium.
Yes.
So it
So
may be differ
all the
from every
policies are
individual.
separate,
Yeah,
sir. All the
Hmm.
yeah,
policies are separate, but under
separate. Yeah.
umbrella of AIS Suraksha.
That's
There
why
is-
I wanted to explain the people,
yes.
because they are having in mind that once you give the indemnity insurance, everything is covered.
No,
So it
no.
is not like
Indemnity
that.
insurance
Yeah,
is one, hospital insurance is one.
That is
Then,
add-on, add-on.
yeah, everything.
it is
Like if
add-on.
you
Add-on.
offer all the five, you get five policies in your hand. But as you said, you don't have to fill five forms. By filling just one form, you get all the five policies.
May I come in? I think
Yes.
it was a wonderful presentation by Dr. Mathur, sir. One important thing everyone must remember, whenever you are porting your policy, changing your company, one important thing you shouldn't forget, that there is a retroactive thing in all your policies. So suppose there is a break of 2 days or even 2 hours, then the previous period of so many years is gone by. So just remember. So don't forget to renew it on time. That's very important. Whatever the policy you are taking, whichever is the company. Then second important thing is, that is just my simple question. We have discussed about cover you, but they are also taking it from some insurance company, other insurance company. So there are national insurance companies. There are 4 of them, and others are private like Bajaj, Tata, ICICI, HDFC. And what is the basic difference in these 4 against those private companies? Can you comment, Dr. Mathur sir or Deshpande sir?
Yes, sir. The difference between these things is, like as you have rightly said, the policy is directly between you and ICICI Lombard, for example, for indemnity insurance. Cover you people get a hefty discount from ICICI Lombard because they have enlisted more than 2 lakh doctors. And we have asked for the statistics from these 2 lakh doctors. Suppose if they pay 10,000 rupees, you can just imagine the amount of revenue to the intermediary. And of that, they say that about 5,000 cases, they have got complaints. Out of that 5,000 complaints, mostly are resolved at the legal notice or out of court settlement or this thing. After all, for cover you, this is business. And for ICICI Lombard, because they are getting 2 lakh customers from cover you, they are giving cover you hefty discounts in the premium. A part of that hefty discount, cover you is passing on to members. Say, for example, AIOS Suraksha. All the AIOS Suraksha members, suppose if we 2,000 of us are together joining this scheme, then you get to benefit out of that discount that this intermediary is getting from ICICI Lombard. A part of that discount is passed on as discount to us all in our individual policies.
My next question is, suppose a person is less than 60 years of age. He has got a chance to increase that sum assured, but afterwards it is less likely. That's what I know. After 60 years, sum assured cannot be added with that particular insurance company. Now, if you are porting from this insurance company to cover your AIS Suraksha, then what happens? Whether that sum insurance can be increased?
That is again, the intermediary will discuss with the insurance company. In our verbal talk, they said they can certainly look into it. And then as exceptions, they can try to help. That's what they said.
Okay.
But one thing is certain, your retroactive date will not change. Even whatever insurance you have now, like my retroactive date of my health insurance is 2005. If I port my insurance next June when I have to renew under AIF Suraksha, my retroactive date of 2005 stands with all the
Yeah.
in
That is
2005
my
I
next
was
question, sir. That is my next question. In 2005, you may not be having any disease. In between,
yes.
because the policy was there in continuity for so many years, once 3 years or 5 years are gone by, whatever disease one gets, even that is covered with that insurance company.
After
Now,
4 years.
if you are porting, in that case, the previous company has not entered about your illnesses. Now this company will enter these illnesses. Now what will happen to the original premium? That will be without disease, with disease, and whether this particular 4 years when you are porting that policy from your previous insurance company to this company, whether these 4 years will be covered or not.
They are certainly covered. Your retroactive date doesn't change. After 2005, whatever illnesses you have got, they are not considered as pre-existing diseases, and your insurance policy with the same terms and conditions are ported from one insurance company to the present insurance company.
Next point is, I think we have discussed this point in past. Suppose you have taken that professional indemnity from one insurance company. Rather than porting, it is being said that you can have additional insurance, professional indemnity from other insurance company.
Yes.
So that in case of problem, one company may help you for that less amount of cover, other company may help you for more amount of cover, and that way both the policies can go hand in hand.
Yes.
What will you suggest, whether to have this policy or change totally, completely, and port with the new insurance company?
Additional policies also act as a backup. It is not illegal. You can have two health insurance policies. You can part claim, like suppose you take an insurance policy from Cover You. Cover You will help you with all their network of 10,000 lawyers all over the country. They will fight the case for you. Suppose if the total is, you take 1 crore insurance. If Cover You has spent about say 10 lakhs on legal costs, so you will be eligible for 90 lakhs of compensation. Suppose if the compensation awarded by the court is over and above 90 lakhs, in that case, your second policy can be a payment policy. What is happening in one of the states, I won't name the state, they have a scheme called Professional Protection Scheme of IMA. So for them, the premium is like they have to pay 1,000 rupees for 10 lakhs cover. So if you take 1 crore insurance from professional protection scheme, you need to pay 10,000 premium. So now, if by paying just additional 6,400, you are getting the same 1 crore insurance through Cover You. That is the kind of difference between. So the members are asking, we are having this professional protection scheme that cannot be, that is managed by the IMA. So that cannot be ported through an insurance company. Now what will happen? Can we take additional insurance through Cover You? So yes, you can take. In such a situation, what can happen is the advantage of professional protection scheme by IMA is the legal costs are exclusive of the term. By paying 10,000 premium, you are getting 1 crore compensation. That 1 crore is intact. Under the IMA will fight your case. The legal costs are separate. You are entitled to get that 1 crore compensation amount. Whereas here under Cover You, what is happening is you are paying 6,400 for 1 crore cover. But suppose if 10 lakhs are used for legal expenses, you are entitled to 90 lakhs of compensation. That is the difference. So you can maintain personal protection scheme as well as the Cover You. One scheme can, with that you can take care of your legal costs. And if the compensation amount exceeds the balance amount in that scheme, you can certainly use the other scheme to pay up the rest. That is a possibility.
Sir, I have a question if Dr. Prakash
Yes, yes.
permits him. Sir, we have been, running that FBS scheme, and I have been a member of that scheme for so many years, and it's very attractive to the youngsters, especially. But we all know that despite the low premium, the sum insured is very less for today's needs, right?
Yes.
And now you are giving us an option of AIS Suraksha with a very, negotiated rate with a good premium. I might have a 1 CR or a 2 CR sum insured for the family. So wouldn't that FBS scheme after the launching of Suraksha scheme will take a back seat, and people will get the young members will get less interested in applying for that? Why pay two premiums when I can have a higher sum insured with a equally relevant premium?
Under the thing, what is happening is when FBS AIOS was launched way back in 2004, in fact, the first two PPTs in those days were prepared by me. So I had a basic doubt, like those days, the premium projected was being compared with the endowment policies. Endowment policies are different. Term life is different. The uniqueness of FBS AIOS is like every year, fresh number of new members have to join. There's a substantial quantity to make the scheme viable. Because if youngsters don't join the scheme today, what will happen is subsequently 5 years, 10 years down the line, the seniors, the incidence of mortality will be more. And then the scheme will be on a shaky ground. So what
Yes.
the basis of FBS is right now, for a 25 lakh cover, you are paying at the rate of 600 rupees per fraternity. So if there are 8 deaths, you pay 4,800, but you get only 25 lakh cover. Whereas in a term insurance for a youngster, say for example 30 or 35-year-old, by investing just about 6 to 700 rupees per month, that is about 8 to 9,000 premium, you can get even up to 1 crore of term life cover.
Exactly.
So that is the kind of thing. But there is sentimentality attached to FBS AIOS. What happens is, suppose more of you, means this is directly stated to YOSI members, if more YOSI members take up family benefit scheme in large numbers, what happens is the fraternity contribution comes down. Now there are about 5,100 members in the FBS. So suppose if 2,000 YOSI members join family benefit scheme, what happens is we have 7,000 members. 7,000 members need to contribute just 25 lakhs. That means instead of paying 600 rupees, the fraternity contribution comes down to 300 rupees. Otherwise, if you decide not to reduce the fraternity contribution, the scheme, the fraternity benefit can go up. Instead of 25 lakhs, FBS may pay 50 lakhs in future. So FBS is a scheme managed by us only. There is no intermediary. FBS is managed by AIOS members for AIOS members. So there is a wide flexibility. More the number of youngsters joining the scheme, the likelihood of either the fraternity contribution coming down or the fraternity benefit going up. That is the
Mathur
thing.
sir,
So as a
So,
thing, and then it has a sentimental value, promotes camaraderie and social networking among all of us members. Those are the added benefits of FBS.
Mathur
that I
sir,
agree, sir. I totally agree, sir. My question was, there is a sentimental value. I'm also attached to it. People have two, professional indemnity policies, maybe two hospital policies, like you mentioned before. But it is very rare to have two life insurance policies. Maximum people have only one substantial amount of life insurance. So, is it advisable to have both?
Nowadays, what is happening is, earlier what we used to do is, whenever we used to, especially in my personal case, the moment I started practice, the fashion those days was to immediately take life insurance policies. Now all those policies are maturing. So nowadays the trend is the power of market, the Indian market. What is happening? What is life insurance doing? Every premium that you pay as a life insurance endowment policy, there is certain portion of that premium goes for your life insurance cover. So why that? You take straight away 1 crore term cover, end up paying 7 to 8,000 rupees premium, and reinvest rest of your saving in the market. You get much more returns, and you get, in the event of unfortunate eventuality, your family gets 1 crore. So now for this moment, as you rightly said, as Dr. Vishal said, it may impact the FBS. So what we are doing is we are promoting term life cover for 50 years to 65 years age group for AIOS members.
uh, sir, Mathur sir, my question is, for the youngsters, they have got a choice to become member of FBS or go with Cover You. As senior person and office bearer of AIS, suppose they are taking both, it's fine. But if they want to go for only one, what will be your advice?
It's up to them. The
No, but
benefits
your
of
advice,
FBS
your
I've
advice.
explained. The
Huh?
benefits of FBS I've explained. The
Hmm.
benefits of term cover we have put forward before them. There are two things before in front of them. You can certainly offer whatever best you feel. The advantages of FBS, I
Okay.
have said, it is a scheme managed by its own members for our benefit. Like that, FBS has also an exit scheme. Like if I am a member, so we have a 25 lakh cover. So I am a member of FBS since 2004. I am one of the founder members of FBS. Till date, I have paid 1,37,500 rupees or something as a fraternity benefit, fraternity premium. So for 20 years, I have ended up paying 1,37,000. in case of an unfortunate event, my family gets 25 lakhs. There is an exit scheme for all those who have stayed in the scheme for 20 years and above. If I want, I can exit FBS next year. I get 7.5 lakhs and take it back. At the end of the day, by just paying 1,37,000 to date, or add just 5 to 6,000 for the next year, I have an option to exit and I can safely take 7.5 lakhs. My investment is 1.4 lakhs, but my return is 7.5 lakhs. But will I exit? I don't think so, because of sentimental value, because of this, like it's a camaraderie factor. You are helping your member
Colleagues, yeah.
as
Colleagues
a
family.
this is your own scheme. You are not paying a constant fraternity benefit. Like last 2 years, we got 10% discount in the fraternity contribution. Instead of 600 per month, we paid 540 per month as a fraternity contribution. So this figure varies. Today it is 600 per death, but tomorrow it can if more members join, it can reduce to 300. Or so consequently, if more members join, either the contribution may reduce to 300 or the benefit may go up to 50 lakhs also. So as a camaraderie, promotion of camaraderie among the fraternity, among our AIS members, I still feel that AIS FBS should be encouraged, should be opted for by all the YOSI members. Plus, if you want additional cover, certain life insurance is certainly an option. So instead of taking a 1 crore cover from cover you can settle for 50-50. You can join FBS AIS, you can take a 50 lakh cover from cover you.
Sir, my next question is, now cover you bonding with AIS has just started. And as rightly said, the disclaimer is very, very, very important. You are just the facilitator.
Yes.
Now, most of the doctors, they pay the premium. There are no issues. These are the rare cases, once in lifetime for the unfortunate incident for that particular doctor. Now, the real test will be for in future, like after 5 years, 10 years, when the members, they already become the member. And the real test is if there is a case. That time we will experience exactly what type of services we are getting from that particular company and experience of the people. I will request Anand Deshpande sir, we are running the same sort of scheme at Maharashtra Ophthalmological Society. And if he feels that he can explain what is the experience, because it is 5 to 6 years old now.
Yes, that is true. The ICICI Lombard only we are using for Maharashtra Ophthalmological Society. And the results are very good. Fortunately, cases are no or meager, very meager in all the period. Or at least they have not openly given to the insurance company or to me. But what came to me are hardly 1% or hardly 1.5% cases have come in which the insurance was taken and the case is lodged now. The experience of the ICICI Lombard is very good. They definitely cover, give the advocate, or they give the advocate charges if the client wants that their own advocate will work, and they pay the compensation also. The experience is not bad. It is very
Thank you.
good with the
Thank you,
ICICI.
sir. So we must remember one important thing. I think this is the take-home message every member who has joined for this webinar, and even if one is hearing the recording, the insurance company must be informed whenever there is an issue from the start, and that communication is going to help you. You shouldn't communicate the insurance company at the end when the issue is really increased, and that time you are approaching the insurance company. That is not correct. From start with, it is not only the telephonic call or oral or verbal communication. It has to be in written format, like email has to be sent to insurance company, and so that they are also involved. And in that case, they cannot say that they were not informed. And you should take them also in loop. That's what I feel.
Secondly, whenever there is a notice from the consumer court, we also put and request the court that I am covered with this and this insurance company with this amount, and so please send a notice to the insurance company and make them a party. So even if the doctor has not communicated to the insurance company and not taken the claim number, that we can solve there in the court itself.
Okay.
Here, this
Excellent point.
recruiter will assist you in all these things. Within 2 years, a lawyer is appointed. If you have your own lawyer, you can select your own lawyer from the panel. All these facilities are there. And that, I think, is the major thing, sir. The moment the incidence is very less, the things are very less. But the very fact that though association legally is not with you, but that's just the power of togetherness, just the power that there is someone to take care of you in your time of hour of need is absolutely vital.
Yes, sir.
Thank you so much, sir. Dr. Dipanshu, Dr. Kaushik, do we have any more questions? Dr. Riddhi, you are there? So if in case we don't have any questions, let's wind up this session. So I would like to thank Dr. Manoj Mathur, sir, for his detailed presentation and throwing light on importance of indemnity insurance. Dr. Anandesh Pandey, sir, Dr. Marathe, sir, and Dr. Vishal Agarwal, sir, for being panelists, and the discussion was really interesting. Thank you, Numerotech, for all your technical help. And I'm sure next time we'll have the smooth login for sure. Last but not the least, I would like to thank YOSI GC for this webinar series, helping us organize this. And see you soon in the next session.
Yeah.
Thank you so much.
Thank you,
Okay.
Manoj, sir. Good night, sir. Good
Thank
night.
you. Good night, sir. Thank you.
Good night. Good night.
Good night.
आज आरतीनं छळायचं ठरवलं होतं.
नाही, आरतीने नाही, प्रसंगच तसा होता सर. बाका
नाही, तिनं ज्या लिंक पाठवल्यात तर त्या जुन्या लिंक 15 तारखेच्या पाठवल्या. व्हॉट्सअपवर त्याच्यावर तेच, पुन्हा त्याच्यावर पुन्हा लिंक पाठवली दुसऱ्या ईमेलवर, तीच आली. शेवटी सपोर्ट टीमनं पाठवली लिंक आणि ती वेगळीच लिंक होती आणि क्लिक केली
तर
की
मी तर तुम्हाला कुठलीच लिंक नाही
record-
पाठवली.
I think
सगळ्या लिंक
record-
कौशिकने पाठवल्या तुम्हाला.
Stop recording.
Stop recording.
Please stop recording.
Once you stop, let us know so
Yeah,
that
it
we
is
can
not
discuss.
recorded, so then only I
Now,
sent.
now you can speak, sir.
Yeah,
Now you
yeah.
Hello, Numerotech
Recording is stopped.
team, have you
So,
stopped recording?
आरतीनं छळलं.
Yeah.
इच्छा
Shall I
होती
stop
आरतीनं
the stream,
छळायची.
doctor?
Huh?
Yeah, please.